In this video, I want to talk about celiac disease, what it actually is, and what the symptoms are. If you like the video and the content, give it a like and subscribe to my channel. This is a great resource for living gluten-free. www.justknowgluten.com. Hello, I'm Mike Hines from justknowgluten.com. Celiac disease is also known as gluten-sensitive enteropathy, sprue, or non-tropical sprue. It is a medical condition that afflicts individuals who cannot tolerate gluten in their diet. Gluten is a protein combination that is abundant in rye, wheat and barley. If you are feeling excessively fatigued and weak and having bowel issues such as frequent diarrhea, celiac disease or excessive gluten in your diet may be to blame. In celiac disease, the absorptive surface that comprises the small intestine is damaged when gluten is ingested. The symptoms just mentioned are a prime indicator that the intestinal villi have become damaged, which is what eventually happens with celiac disease, leaving you unable to absorb vital nutrients, minerals and vitamins. This in turn leaves the body deficient in much needed and required healthy fats, carbohydrates, minerals, proteins and vitamins. A lack of these requirements for good health leads to generally feeling run down and lethargic, combined with frequent digestive upset and other seemingly unrelated symptoms. Celiac disease is actually very difficult to diagnose. There is truly not a typical case of celiac disease, yet an accurate diagnosis is essential to overcoming the patient's symptoms. It affects each person differently, and it can actually differ for men, women and children. That's why it can be so tricky to diagnose due to the vast differences in symptoms. In fact, even though overall celiac disease diagnosis rates and awareness seem to be improving, it has been common for patients to unfortunately go up to 10 years without receiving a correct diagnosis. Celiac affects women, men and children in different ways, and we're going to have a look at all three. Women and celiac disease. A significant study was conducted that found that approximately 40% of women reported other symptoms of celiac disease, such as infertility and menstrual disorders. Half of the women claimed that their menstrual cycle issues developed prior to any other symptoms of celiac disease. Approximately 30% of women diagnosed with celiac disease also had a secondary autoimmune disorder of some kind. Of course, any of these symptoms may be linked to other medical conditions and nothing at all to do with gluten sensitivity. The only way to determine if celiac disease is to blame is to undergo an intestinal biopsy that shows villus atrophy. Villus atrophy occurs when your intestinal villi, that is the microscopic finger-like tentacles that line the wall of your small intestine, they erode away, leaving a virtually flat surface. Celiac disease is best known cause of villus atrophy. Right, let's look at men and celiac disease. In men, celiac disease has been linked to infertility. Just like women, approximately 30% of men experience autoimmune diseases, including Sjogren's syndrome and some thyroid disorders. Sjogren's syndrome is a disorder of your immune system, identified by its two most common symptoms, dry eyes and a dry mouth. The condition often accompanies other immune system disorders such as rheumatoid arthritis and lupus. With Sjogren's syndrome, the mucous membranes and moisture-secreting glands of your eyes and mouth are usually affected first, resulting in decreased tears and saliva. Although you can develop Sjogren's syndrome at any age, most people are older than 40 at the time of diagnosis. The condition is much more common in women. Treatment seems to tend on relieving the symptoms. Men have also shown higher numbers in forms of celiac-related reflux and exhibit more liver abnormalities compared to women. Men also seem to get more itchy skin rashes compared to women. Celiac disease and children. Children with celiac are often very skinny and seem to fail to thrive. Compared to children of a similar age, they may be behind the normal rates for height and weight. They may suffer from a number of medical conditions, from abdominal pain, smelly diarrhea, or episodes of frequent constipation. And due to their constant bloating, their stomachs may stick out. Is it celiac disease or is it Crohn's disease? Celiac is sometimes misdiagnosed as Crohn's disease. Crohn's is an inflammatory bowel disease that enables the formation of ulcers to occur anywhere in the gastrointestinal tract from the mouth to the anus. It's very similar to celiac disease with the same kind of symptoms: feeling nauseous, extreme tiredness, diarrhea and unexplained weight loss. Symptoms of celiac disease. Quite often, people suffer from abdominal pain, fatigue and weight loss due to the inability to properly digest and absorb the minerals and vitamins from their food. It is also important to note that celiac symptoms can affect practically every system in the body. For example, your joints, hormones and skin can all be affected. Acid reflux and heartburn is also a common occurrence, which can lead, of course, to vomiting and eventually cause ulceration inside of the mouth. Sometimes people only discover they have celiac disease by visiting the doctor on a purely unrelated issue. Now, this is important. Once you have been diagnosed with celiac disease, it is forever. So adopting a gluten-free diet is so important in order to avoid long-term health complications. For example, there has been a link to a higher incidence of certain kinds of cancer with celiac disease. The majority of your symptoms can be resolved by following a strict gluten-free diet. The majority of your gastrointestinal symptoms will disappear once you adapt to eating gluten-free foods and are no longer irritating your intestinal lining. Lots of patients report huge improvement in additional minor ailments. There are many symptoms that are associated with celiac that are not intuitively connected by the patient. For example, your skin improves after eliminating gluten from your diet. Celiac disease will affect people differently, and remission will also vary from patient to patient. Sometimes even those individuals who religiously follow a gluten-free diet may continue to suffer from specific symptoms their entire lives, such as osteoporosis or irritable bowel syndrome. This is because the damage was already done before removing gluten from the diet. Do you have gluten sensitivity or do you have an intolerance? Many people are discovering that they suffer from some level of gluten sensitivity or even a complete intolerance. If that's you, then stop using gluten. The majority of baked goods such as breads, pizza, dough, bagels, muffins, etc. all have loads of gluten in them. Many of these foods consist of simple carbohydrates and may form a large part of the regular diet. When a gluten-free diet is undertaken, many people with celiac disease find that they lose weight as they're eating better types of food. What is the connection between celiac disease and malnutrition? It is also common for many undiagnosed individuals with celiac disease to be quite thin due to the malnutrition their body has suffered. This happens in spite of eating large quantities of food regularly. The gluten they consume on a regular basis interferes with their intestinal lining and inhibits their ability to absorb the nutrients, vitamins and minerals from their diet. Instead, they simply excrete these substances in the normal manner. Over time, they may suffer from stunted growth, have low bone density and seemingly unrelated neurological problems. This causes ongoing problems on numerous levels, and they can become quite ill and run down as a result. Thankfully, once they are diagnosed with celiac disease and are on a gluten-free diet, many health improvements can be noticed in the very short term, providing the diet is sustained. Do hope you enjoyed this video and you found it helpful. And thanks for watching. I'll see you in my next video. Bye bye for now. See you soon.